Morning, everybody. Hi, Rachel. Thanks for being here. An easy walk from New York Presbyterian, your offices. Could you tell us a little about, this is a city of big hospital systems, and could you tell us a little bit about the culture and scale of New York Presbyterian?
Of course, I'd be happy to, and thank you, everyone, for having me this morning. So New York Presbyterian is one of the top academic medical centers in the United States. We have 11 inpatient facilities, 2 of which are behavioral health. Our footprint is the 5 boroughs of New York City, but also Westchester County. We also have dozens of medical group offices, ambulatory practices, so we really run the gamut, the full continuum of care. Our workforce is about 50,000 strong and every bit as diverse as the city itself.
Well, in jobs too, roles probably, that's so diverse in terms of what you cover. You're so comprehensive that you must have all kinds of specialties.
We do. We have all types of specialties in the physician ranks, nurse practitioner, advanced practice providers of various ilks. But we also have the operations side of the house. So you also have food and nutrition. You have environmental services, patient transport. We also add in a layer of complexity, but also real prestige to our organization. We're partnered with 2 of the top academic medical centers in the country. So that would be Cornell and Columbia. Their medical schools are our academic partners. So we have their physicians that are part of our fold as well.
Now you took an interesting pathway to your role. You came from out of town to Brooklyn to study. Tell us a little bit about that, and then how your pathway took a kind of nonlinear way.
Yes, I definitely have a rather unorthodox background. So I moved to New York City to study photography at Pratt Institute, which I joke with my colleagues is the natural segue to a career in human resources. Lo and behold, when I was getting ready to graduate, I actually was hired via a staffing agency to work for what was then Hay Group, a management consulting firm. And I got hired in literally an administrative role. And people saw my potential, and I worked really hard, and I ended up making a career there. I stayed at the firm for probably 13, 14 years. And at the point that I left, I started as an admin, and I left as a consultant with a book of business, and NYP was one of my clients. So yes, I've never really had a straight path to get where I am. I've just sort of grown organically over the course of my career. But I've also had the privilege of landing in places that allowed me to do that, which is something I'm very grateful for.
Entry-level jobs are still wacky, and I remember in my day too, my first job here in New York was answering letters to the editor. So I typed those out. Anyhow, so I tell that to kids today, that you never know where you're going to get started. Now, let's get to our main topic. You used the term in our earlier conversations about the din of stress right now for workers in general, and that's something that benefits and total rewards specialists need to be aware of and respond to. Can you just paint a picture of what some of those inputs are that the people are getting bombarded with? Yeah,
of course, and I'll give some context that working in the healthcare space, I've been at NYP since 2018, so I was there, before, during, and post-COVID. And that was a place in time where there was very visible, overt stress, right? Unprecedented times. And we've come past that hump, but I'm not sure that all of the anxiety and the agita is gone. It seems like it's still there and it's still simmering. And in our current social environment, whether you want to attribute it to politics or policy or anything else, there's a lot of unrest. There's a lot of frustration. There is a lot of polarization of different topics. And I think that we have to recognize that people don't leave that at the door when they come to work. That's not home and family life, and then you come to work and the switch flips off.
Yeah.
It's something that people carry, and particularly now as we're watching market volatility, we're waiting for the impact of tariffs to take hold. People are looking at their 401ks and saying, oh my God, what's happening? They're worried about what their business is doing to cope with some of the volatility. And that level of insecurity is a drain for people.
Yeah.
It's exhausting, it's frustrating, it shortens people's fuse.
And you've made a particular connection to financial stress. So that, in fact, you mentioned that you think it's actually part of burnout. We talk about burnout and you think it's just because of workload and this and that, or home and work, but the financial part uses up a lot of people's bandwidth, right?
It does, and I think that there's absolutely something to be said, and there are studies on this as well. I participated in a webinar, I think it was sponsored by Mercer, it was a global study, and financial insecurity was the #1 source of burnout that their research showed, and I believe it. If you do not have guaranteed food on your table, you're concerned about how to pay for your son or daughter's college tuition or daycare costs, or you have an aging parent that does not have resources to the care that they need, you are constantly thinking about how to manage that. And again, you don't walk into work and the switch flips, and now you're in work mode and you're not in home mode. People carry that with them, and it continues to drain them. And we, I think, as employers, we're limited in some ways of how we can mitigate that. But I think that we have to acknowledge it and try to find ways to support people so that they can show up and be their best self.
Well, I imagine you don't want people in a healthcare setting being preoccupied with like their late fees or something when they're having to attend to a patient and go through checklists, and so it's critical. It is, and you raise a good point that in the healthcare environment specifically, yes, if you have distracted workers, if burnout is high, engagement is usually, the other lever there, they're counter to one another. If engagement starts to drop, you are more likely to see patient quality and safety issues, your patient engagement or satisfaction scores start to dip, and for a healthcare system, there are funds, there's a monetary connection to that. So it's important that we preserve it, not just for the benefit of the patients, but also helps the institution. Even outside of healthcare though, if people are showing up at maybe 75% of what they could be, it impacts productivity, it impacts the quality of their work, speed and turnaround. So even outside of the healthcare space, I think that any institution needs to be plugged into the impact this has on their workforce. Is there any one particular area where you found it to be effective in addressing people's financial concerns?
Yeah, something that we've done at the hospital that I think has been very helpful, recognizing in a hospital setting, nurses are a big part of our workforce, and nursing does still skew female and particular age brackets. So thinking about the demographics of our employee body, we have invested a lot in what I'll call them family-friendly benefits, but it's really a continuum of supports for, daycare subsidies, backup care. Later on, when your kids are older, we have college coaching services that are available. We have elder care services available. So we've invested in a lot of those programs to help mitigate absenteeism that might be associated with, my nanny called out sick this morning and I have no backup care. We have programs that can help you that are highly subsidized. My mother is aging and I have to take her back and forth to appointments. We have services that can help people with that. So they're able to come to work, they're knowing that they have resources available for whatever is happening outside of work, and they can be more focused and hopefully a little bit calmer about balancing those two situations. That's one example.
Let's talk about one of the hottest topics around right now in terms of benefits, and that's GLP-1 drugs.
Yes.
And you cover them. Well, tell us about your philosophy about it, and also just a kind of longer game. You've told me about there's a short term gains in terms of outcomes, and then there's potentially long-term, which is fuzzier, right? We don't know.
Yeah, and I thank you for using my analogy of the short game and the long game. And this is a place where, for New York Presbyterian, right now we're playing the long game. Everyone's concerned about the cost of these medications, and yet the benefits that they have specifically for diabetes, which is where they've been on the market for diabetes treatment for some time, newer for use specifically of weight management. All that said, the efficacy in helping people lose weight is quite tangible. There are real results there.
Yeah.
So we are, I'll be honest, taking the leap of faith that if we invest in these medications now, in the long game, as you mentioned, people will have less sleep apnea, cellulitis. They may not develop diabetes, which has a whole number of knock-on effects, right? Neuropathy, hospitalizations, right? Diabetes is cited as the most expensive condition to treat in the United States. You think that it's cancer or something requiring cellular therapy. It's actually diabetes. So we have decided.
It's on the rise, I believe. It's on the rise.
It is.
Yeah.
It is, but also the cost of treatment of it. And it has a big ripple effect. That's one of the things about diabetes as a condition, is it's not really just one condition. It becomes many things, and it becomes very complex. So we've decided we're going to make the investment. Personally, I hope that the bubble around GLP-1s starts to deflate soon. I don't know if it's going to burst in a moment, but I hope that it starts to deflate and the cost starts to be reined in as competition changes in the market. But my final point is I will be very honest that, again, the leap of faith is that these drugs have not been in the market for this type of usage long enough to really have a test case of, yes, 10 years down the line, we're having less claims associated with some of these associated conditions.
And the pharmaceuticals will change too. Some will become generic. It's a game that's moving as we go forward.
Absolutely. There's pill form that's supposed to be coming out to market soon that may change the costs associated with storage, transportation, and the like.
Now, even as those costs, you're investing more in those sorts of things, there's pressure from the other side to cut costs. So how are you responding to that?
Yeah, that's the tough one.
Yeah.
And this is where I think it's incumbent on us as leaders, particularly as we're working with our operators, our finance leadership, to remind people that these are investments in the business. Yes, they're costs. We can't spend money we don't have. But investing in your workforce is the same as investing in equipment that you need. You can't run a business without people, and those people need to be healthy. They need to be plugged in. They need to be engaged. And we can't lose sight of that. I do also, on a more practical level, think that this is a very opportune time. We all in our organizations are looking at market volatility and costs and saying, what does this mean for us? Your vendors are doing that too. So don't be afraid when you're going to contract, or even if your contract isn't up, if there's something that you want or you need, you want more transparency on your pharmaceutical pricing, ask for it. The worst they can say is no. More often than not, and this is not a promise, don't hang your hat on this, but those vendors don't want to lose our business. I do have the luxury of working for a large employer that does give you buying power.
50,000 people.
But don't dismiss the buying power of your organization, right? You may be able to get more if you press them. Don't be afraid to. The worst they can say is, no, we can't accommodate it.
But that's a good tip. And can you also ask for evidence too? I mean, if you have somebody who's a service provider, service vendor, you might ask we're not sure we're getting the outcomes we want. Isn't there some pushback that you can do there too?
It's possible. Some contracts do allow for actual ROI, particularly as more kind of niche players pop up in the medical and health plan continuum. There are a number of, I'll call them startups because they're still relatively new to market, that are saying, well, we provide you this sort of niche or concierge service for this type of condition. And sometimes they will in their contracts have a guarantee that you will get a minimum of this if you invest in our business. And you can, of course, hold them to those terms. So that's something that you should absolutely ask about if you're going down that avenue.
Now, when you're asking your chief financial officer for a certain amount of understanding in terms of what is the benefit of the particular kinds of support, there's also the negative outcomes you're avoiding too. You mentioned all kinds of things like absenteeism, leave of absence. Could you tell us about that a little bit?
Yeah, absolutely. And this comes back to the notion of making investments in your workforce. There is a supply and demand for talent, just like there's a supply and demand for materials, for equipment. We don't like to think of our workforce that way because we're people and people are more complex than that. But at the end of the day, to keep the machine running, all systems need to go, and your people are a big part of those systems. So I'll give a very practical example just from my own life. I have a mother-in-law who's starting to, fail in health a little bit. She needs some additional supports. And I went through a journey of trying to find an attorney to help with financial power of attorney. I spent weeks doing this. I had a really frustrating conversation with a lawyer that I absolutely would not hire. And immediately afterwards, I had a very important work meeting that I had to join. It would be generous to say that my brain was 50% in that conversation. So many organizations are starting to think about what types of services can we offer that would keep me or the equivalent of me from spending those hours, the mental brain drain, being distracted from work. There's a point where that becomes worth the investment because you lose productivity, you lose quality. What's incumbent on us is to make it scalable. It can't just be about me, Rachel. It needs to be about our workforce. And that's where you start to get the mass and the volume to make the case compelling.
And it's probably certain things that people don't need all the time, but there'll be a point in their life like yours where it crops up and it's consuming. And
Correct.
That's a negative
Correct.
on the business. Yeah.
It's episodic, but they're also, again, back to the notion of contracting. For these vendors, see how it is contracted. Is it a flat rate where you're locked into a fee, or are you paying on an episodic or as incurred basis? And then it's scaled to the need of the organization. So don't be afraid to push those levers and those boundaries with your vendors.
Now, of course, I'm required by the new tradition to ask you a question about artificial intelligence. That's part of every conversation. So,
Yes.
so you had one application that seemed pretty interesting in terms of just kind of looking at working with your vendors to try to find some patterns you could respond to.
Yeah, we specifically and very recently have been working with our health plan administrator on, again, because of HIPAA reasons, we're not in our claims data, let me make that very clear. They're looking at the data for us, but can we look at our population where we either have actual diagnosis of diabetes, pre-diabetic, or also certain patterns in claims that suggest that someone might be on the pathway there. Mm-hmm. We don't need to know who those individuals are, but partnering with the vendor, can they send out, as they send out postcards for things throughout the year, can they send out postcards to those individuals, not saying, hey, John, we looked at your data and we think you're pre-diabetic. We're not doing that. But can we send out reminders that we have well-being coaches on site that can help you manage your health overall? Even the insurance carrier has certain well-being programs that are under that umbrella, and you can sort of subtly put them out to people in a way that doesn't appear targeted, but actually is targeted. And then we're avoiding the cost of a mass mailing to a population that may not actually need to be pushed to those services.
I have a question which I didn't give you a heads up about, but you said I could ask questions.
You can, that's okay.
But you're not only a healthcare provider, but you're a major employer. So are there ways in which, by being in healthcare already, there's a term, eating the dog food or whatever it is at a startup, where you're practicing on your own people?
Yeah, practice what
Are
we
there
preach.
have you ever gotten any insights that you then can apply, by being a provider, that you apply to your employees?
I think that the one place that we've had some advantage, when I think about our EAP, our Employee Assistance Program, we actually have a partnered EAP with the Behavioral Health Department at Cornell University, their medical school, which has been a real gain for us because we're not just putting together a program. Yes, there's social workers and counselors, but it's backed by real, cutting edge research and science and medical understanding of psychiatry. We're not prescribing medications to people, but being able to come out with that more maybe holistic viewpoint, I think has given us a richer program and also lends a lot of credibility to it with our employee base.
Yeah, and people are also skeptical of EAPs. Are they really that helpful? Is there that much participation? But this sounds like you supercharge it really with clinical insights. Yeah.
We do, and we were very careful about branding it and promoting it as being something with integrity. We also opened the EAP up not just to employees, but their families, to try to encourage people, more collectively to seek services. If something's happening within your household, it's not just an issue for me and my husband doesn't notice or care. There's that ripple effect when things are happening within your family. So we've really promoted it as something that, yes, it's there for you as an employee, but it's really about you also taking care of your family and allowing us to try to give you the resources to help do that.
Wow. Now, we just have a couple minutes left. I was thinking if there was one thing you could advise people to take back to their workplaces and help their people in terms of addressing the din of stress, as we talked about at first, what would that be?
Here's where I'm going to frustrate the room because everybody's waiting for a magic bullet on plan design.
You don't have a quick fix?
Yes, we don't. I'm actually going to pivot a little bit on this one and say that in this space, this is where I think it's incumbent on all of us to think about how we show up as leaders. And I know that that's something that I think about quite a bit. And I'll refer back to in 2020, when we were maybe past the worst of COVID, sort of the March, April was behind us. It was probably around June of that year. I was in a leadership forum, and the head of our behavioral health services at NYP said to the group, he was, just giving his little spiel, and he said something that still resonates with me today. And he said that it is part of our job as leaders to sell optimism. And that doesn't mean that we need to convince people that things are good when they're not. That's disingenuous. But it means that we need to be honest and sincere about the circumstances that we are in collectively or individually. but bring that sense of support, togetherness, and the notion that whatever it is, we're going to get through it. Better together than separately. And I think that, as a colleague of mine says, that kind of sounds like mom and apple pie, but it really makes the difference in how people show up, right? Are they coming to work feeling supported, feeling that you get it, or is work becoming another source of stress for them? You can't fix their financial problems, but you can make them feel heard and appreciated. And that's something that I reflect on quite a bit as a leader, and I will say, to the chagrin of CFOs everywhere, you can do it at absolutely no cost. So please don't take for granted the role that you as a leader play in setting the tone for your team.
Wow, well, perfect. That's easier said than done. But of course, yes, acknowledging the situation, but then showing a way forward. Yeah, that's
Be
great.
consistent,
Yeah.
be consistent and be supportive.
Yeah. Well, thank you, Rachel. This was
Thank you.
terrific. Thank you for being so candid. Appreciate your being here and kicking things off.
Thank you.
Thank you.